Hello, I'm Laurel Jackson from Western Sydney University, Australia, and together with my co-author Bobby Banerjee from Cass Business School, the City University of London, we'd like to talk about our recent paper, which was published in Human Relations.
In our paper, Microfinance and the Business of Poverty Reduction, Perspectives from Rural Bangladesh, we examine the role of market-based poverty reduction initiatives. In particular, we look at the role of microfinance in reducing poverty. Microfinance, or the provision of small loans to the poor with the aim of lifting them out of poverty, is a big industry operating in more than 60 countries. Its advocates claim that microfinance will help lift the poor out of poverty, it will promote entrepreneurship, it will produce better health and social outcomes, it will increase social capital amongst the poor communities.
Our findings, however, reflect a very different picture. In our ethnographic study of 3 villages in Bangladesh, we found microfinance led to increasing levels of indebtedness amongst already impoverished communities and exacerbated economic, social and environmental vulnerabilities. In gaining insights into the lived experience of the chronically poor communities, we found that we needed to provide a more expansive concept of chronic poverty, taking into account feelings of vulnerability and associated risks experienced by the extreme poor.
Our findings indicate that microfinance increased economic, social and environmental vulnerabilities of the poor communities in our study. It led to poor health outcomes, inability to pay back the loans, eroded the assets of the community. It also damaged household relations and social relations within the community. People were taking loans from one microfinance provider to pay back loans they had taken from another provider, and that led them to a spiraling level of debt which they could not escape.
Our findings indicate that microfinance heightened feelings of social vulnerability through processes of surveillance and disempowerment and shaming. There were increased surveillance within and between groups of borrowers, leading to a slow erosion of trust and social cohesion, which is a key component of social capital. Women borrowers, fearing default by a group leader, engaged in surveillance of member behaviour after a loan was taken. And since family members were also involved, the entire community became a mechanism of surveillance, leading to conflicts and discord. A politics of shame surrounds much of microfinance activity when it comes to non-payment of loans. Public shaming is a particularly effective way to ensure repayment, and several NGOs resort to these practices, often using the police and courts to enforce payment. Typically, the women are blamed for bringing shame and dishonour to the family home, although husbands and other males are the primary beneficiaries of the loans. So despite its claims of empowering women, microfinance operates very much within a patriarchal system.
Our ethnographic study enables us to build a grounded model of the vulnerability dimensions of poverty. Most of the research in microfinance is about people who are empowering others. It focuses on empowerment with very little attention to those who are supposedly being empowered but are actually living in abject poverty, exacerbated by schemes like microfinance. So our study is an attempt to build such a bottom-up model.
If microfinance is to address poverty alleviation, the real challenge is to identify what services are needed for the poor to meet their complex livelihood needs, rather than pretending they're all small farmers or micro-entrepreneurs. Better social and economic outcomes could be achieved if social investment was directed at initiatives aimed at reducing the risk and the vulnerability, such as building hospitals and schools, investing in building and supporting local businesses to provide employment and a steady income all year round for family members, or investing in social movements for fair and equitable access to land for farming. If impoverished communities are to be empowered, we need to provide opportunities for chronically poor people to tell their own stories about their real situations and discuss their real needs. And we can start to empower them by listening.